Thank you for coming on time. We are having a little bit of, we'll have to have a bit of waiting for someone to log on, but we'll be with you shortly, just in a minute. In the meantime, please enjoy the slides. Hello. Thank you. Yes. Good morning once again. This is Purposeful Aging. This morning, bright morning, 28th October. Good morning, fellow seniors, our caring caregivers, friends, and everybody online. Thank you so much for coming on. The usual moderator, Christina, take you through this morning. This morning, we are going to share experience and tips to do with one of our precious parts of our body, and that is the eyes. As you've seen the topic, aging and your eyesight, living with deteriorating vision. Purposeful Aging is humbled to have one of our senior ophthalmologists, and for some of us, we had a chance to be taught by him. This is Senior Dr. John M.L. Otiti. Dr. Otiti, I'll give a brief introduction. He worked in Mulago Hospital, Makerere Medical School, as it was known then. Many of his students will agree with me that he gave the most student-friendly lectures from the Department of Ophthalmology. And interestingly, he always wears a $1 million smile up to this day. No matter what has happened in his life, which we are going to hear soon, he's always smiling. Whether you're a student, whether you're a senior, he will greet you with a smile. Yeah, he later practiced at Eye Clinic in Kampala Road, and then moved to Kira Road at Georgina Eye Center. At Georgina Eye Center, he was joined by a daughter, Dr. Juliet Otiti Sengeri, who is also a practicing ophthalmologist. She has wide experience in both locally and internationally. Otiti Juliet, as we can call her, I think this morning, she has kept the family practice running as the leading ophthalmic and surgical clinic in Uganda today. Many of us have the impression that to have any operation on your eyes, you have to go out. I think this clinic has demystified that. Juliet herself, just like the father, enjoys and gives out very, very deep caring service when you visit that clinic. Yeah, the two are our facilitators this morning. And I think we are going to go straight into them. I'm going to give it to them without wasting a lot of time. Just to remind you that, yes, you can have comments and you can have questions written up in the chat. We shall have some 30 minutes from 11 o'clock to go through this exchange. Dr. Otiti John and Dr. Juliet, you are most welcome this morning.
Thank you.
I've been anxiously waiting for the tips from your rich experience and also from the modern issues from Juliet. Purposeful Age believes that after this session, all of us seniors will know how we could live more comfortably with deteriorating eyesight. The caregivers will also know how to take care of the senior eye issues better. And for the younger ones, how to avoid those things which will compromise their eyesight. This knowledge and these tips we are going to acquire this morning. The session, as usual, is interactive in the chat and by raising of our hands. Dr. Otiti will open with the experience and the tips he has had. Once again, you're most welcome, Dr. Otiti John. Thank you, and please give us your experience for the next 30, 45 minutes. Thank you.
Joe?
Yeah.
Hmm?
Yes. You can talk. You can talk.
Good morning to you all.
Good morning.
I am grateful that you pulled me out of my hibernation to talk to you and the audience about ophthalmology. I joined the ophthalmic studies in 67. And at that time, we had only one Ugandan ophthalmologist. And what he said, and quite true, that the eye is the most brilliant organ in the body. It receives about 6 to 7 direct cranial nerves. So it was made a very perfect organ for seeing. It's one of the organs which start developing very early at 7 weeks. And by the 28th week, it is claimed a child is able to recognize light and sound. Light. At the time of birth, certain factors are not very functioning. That is the central vision, that is the macula. But it is able to see light and dark. And within 2 years or so, everything is set. But in biology or in health, in human beings in general, we have to accept that when something is formed, it exists, it functions, then it dies. Before death, degeneration takes place, and the eye is not excused. So when we grow old, a number of things come in. How we looked after our eyes, how its function was aided, how much we avoided in getting infections and so on. and minimizing the chances of onset of diseases that can cause eye problems. Now, in our place here, the tropics, the strong sun is quite a leading contribution to changes at the front of our eye and blurring of vision. Right from the beginning, let's talk about the convergence of light onto the eye. The cornea, which is the front window, is the chief bender of light to our retina. Then the lens comes in. The total power of those two is about 42 diopters. The rest is done by the media through which the light passes. Now, one of the problems that begin to occur with the vision is that these media change. The cornea may get hazier, thicker, and a little more curved. Then you cannot focus the image properly on the retina. The most sensitive part of the retina for daylight vision is the macula. This structure is about 15 degrees to the temporal side of the visual axis. When you're looking directly, if you want to, directly it is the macula. Now the optic nerve is what I meant. It's a little to the temporal side, about 15 degrees. Now the retina has sensitive receptors, that is the rods and the cones. The rods function mainly in night vision, while the cones made with the bright light or day vision as to where. I usually explain the example by using weight instead of light. The rods, let's say, respond to a weight of 400 kilograms. And the cones will start in thousands of kilograms. So at night, the cones cannot work. They cannot transmit the light. So you depend on the rods. And when the light is too bright, the rods cannot function because the weight as to air of light is too much. So one of the problems you see as we grow older is seeing at night. The rods may have been overpowered by too much bright light. Now they take time to come up. This one is exemplified as adaptation to darkness. When you come out from bright light into dark, it will take you some time because the cones are now silent. The rods have not woken up properly. Although the light in the room may be good enough for the cones to work, but it takes some time. So dark adaptation is one of the first things we see as we grow old. The second one is when the lens can no longer focus or adjust its focusing properly. The lens is like, say, an onion, and as it changes its curvature, the components slide in and out, up and down the constitution of the lens. Now, as we grow old, that mechanism weakens also. So focusing may become a problem. And it's particularly seen as you reach the age of 40, that focusing divergent light.
Yeah. Okay. So let's agree on where they can.
It's just an interruption, don't worry.
Sorry?
Sorry for that.
Continue.
I continue? Yeah, then convergence of rays of light. Huh?
She said continue.
convergence of rays of light from near things like what you are reading becomes difficult because the lenses can no longer change to the power required to focus on the screen, that is the retina, given a fixed distance of your eye. So you find it difficult to read small letters, you find it difficult to thread needles and so on. Now, most of this can be aided by external glasses. The other point is with the media, the vitreous, the jelly that fills the back of the eye, the elements seem to change with the age, and you may find the refraction is not as good, but then you can get some things floating in the vitreous that may impair the vision. Now, like I said before, the degeneration is definitely to come as you age. The muscles that increase the power of the lens or decrease it also age. That is ciliary muscle. It may not be as strong as it used to be. So changing focus can be a problem. Another problem that comes with age are the very silent blinding diseases. One of them is the glaucoma. This is an increase in the eye pressure. The eye has got as it were, a factory in the anterior portion from the ciliary body, the ciliary muscle, and some projections there. That changes, the fluid is got from the blood system, and on exit, aqueous. Sorry?
Continue.
Oh, the fluid is called the aqueous. It exits the eye in the angle between the cornea and the iris. Now, some age changes occur in the hole through which the aqueous exits. So as you grow older, you may get glaucoma, but without knowing. It is a slow blinding disease. The macula has a lot of eye receptors. So you may not notice that your vision has gone down. And what high pressure does is to kill the nerves that see. Now, the nerves at the macula, that's the real central part of the eye as you look forward ahead of you. There are plenty of fibers there. So the death of some may not be noticeable. But at the periphery of the retina, the fibers are few. They die quicker, and you may go blind in the peripheral vision, giving you what we call tubular vision. And because the central vision is still okay, you may not notice that there's something wrong. But when the eye examination is done, they can detect the pressure of the eye. There's an instrument we use for measuring the pressure of the eye. They can look at the nerve head. The one I said is about 15 degrees off the visual axis, and see whether there has been damage. What happens at the nerve head is that slowly it gets excavated by the death of the fibers. You see like a cup, whereas the optic nerve head is flat in normal eye pressure. The pressure in the eye excavates that area, and you see it as a cup. So glaucoma is one of the problems we have. Accommodation I've already mentioned. A few eye diseases make old age vision go down. One of them is diabetes. The other one is high blood pressure. Both of them affect the vasculature within the middle coat of the eye, that's the choroid. And you may get bleeding scattered here and there. and cause your vision to go down. I think those are the main things that come up with age. But in vision itself, the visual acuity is tested, as you know, by a chart called Snellen's chart. Each picture gives an angle, a picture that focuses, that forms an angle at the reception center in the macula of a certain extent. It's 5 degrees of an angle. The things that make one different from the other one must sustain at least 1 degree. So if you have a letter like an E or an F, the top bar should be separated from the middle one by a certain amount of separation, then the middle one separated from the bottom one, or the stem of an F, or in that case, in the case of E, the actual horizontal arms. Then you notice an EXO. So this system is used in measuring the amount of how good the eye sees. Now, that alone can go down with age as the back of the eye degenerates, like we said. Everything degenerates with the time to a certain extent. But these subsequent diseases can hasten the degeneration of the macula. I think that those are the main things that really affect us, which can be easily detected. But going back to vision itself, we are able to see black and white and shapes and sizes. But one aspect of vision which makes us relate to our surroundings and so is depth of vision. For this one to be accomplished, you must have both eyes function well. If they are not synchronized properly, you will not see a three-dimensional picture of the object you are seeing. And if you don't see that, you may not know what is near you and what is far. You cannot relate to what you want to hold and so on. One of the things you can see among the caretakers of old people is how they start pouring tea in their couch and they are pouring outside until you tell him, hey, Muse, the tea is pouring outside. You cannot tell the difference between the water pouring into the cup or ahead or below, before or behind the cup. Accurately, when your depth of vision is impaired, your stereopsis is impaired. I think that covers the basics of eye problems with old age. I'm there, so I know. Thank you.
Thank you so much, Dr. Otiti. I think we'll have Juliet, and then we can get the questions and comments afterwards.
Thank you very much. Can I share some slides?
Yes, please. You have rights to share.
You can.
Okay, let me do that. Thank you very much for this opportunity to discuss what happens to our eyes when we age. Dr. Senior has mentioned most of them, and I'll just go through a brief summary, and I'll invite him to emphasize some points where he feels necessary. We prepared these slides together yesterday, and his input is highly appreciated. So, as he has said, we can't stop the process of aging, and it's something that's going to happen to all of us, and it's important for us to understand what could go wrong and know what can be done about it, so that we can try to enjoy our lives even though we are aging. So as he mentioned, he talked about the presbyopia, where the lens does not function as it should. So you notice that you're pushing things far in order to focus, and also if you are short-sighted and you are using glasses to read, you find you have to remove them in order to see. So this is an illustration of what presbyopia would look like. And he explained it in detail. He had wanted us to share this image of what the parts of the eye so that you understand what is involved in the focusing. He mentioned the cornea, which is this front part of the eye that is important, which bends rays of light to fall on the retina. So what we have in presbyopia is the lens is weak, it doesn't change its shape, and the muscles he talked about are also aged. So there are muscles and there are ligaments here that suspend the lens. So it's too weak. So the image falls at the back of the retina instead of falling at the normal point of the retina. And that's what happens in presbyopia. But that starts at the age of 40, as he mentioned, and that can be easily corrected with reading glasses. Another thing that he has already mentioned is clouding of the lens, which we call cataracts. Here we have an image of what a cataract looks like. And on this side, you have an image here where there is no cataract. One thing we mentioned that we talked about in a discussion yesterday when we were preparing these slides is to learn to look at this reflex in your patients as caregivers or even as friends and family members. This reflex here in the pupil should look like this. So if you see it looks up, if you find it looking abnormal and having anything white, or if you enter a dark room and use a torch of light to look and see whether there's a nice red reflex. When you shine light in a dark room here, it looks red or orange. So if that red reflex disappears, then you know that a cataract is probably forming and they need medical attention. Fortunately, cataracts can be operated safely with a 99.9% success rate. So we encourage you to have it checked and the operations are safe and you can have it done and your sight is restored. We usually leave the elderly to decide because cataracts are not an emergency. Let them make their decision on their own, but encourage them that the surgery is safe and it can be, and vision can be restored. This is what vision looks like when you have a cataract. Here it's clear, and on these other slides, it is blurry, like something has been painted on a window. Then he talked about increased pressure in the eye, and he talked about how the eye needs to have a certain pressure. So the increased fluid in this back of the eye is what causes the excavation he talked about on the optic nerve, and resulting in damage of our nerves, and then vision is lost. This is the silent killer of blindness, and it's something important to know, and it's painless. It can only be discovered when you have your eye pressure measured. So this one requires you to have regular eye exams. In case it is found and you start on treatment, you can at least hold the process of vision loss due to glaucoma. Glaucoma tends to run in families, so if you have a family history of glaucoma, it's important that you emphasize on regular eye checks to check your eye pressure. This is the excavation Doctor was talking about, and this is what the normal optic nerve looks like. So as this excavation increases, there's a lot of visual field loss, especially in the periphery. This is an example of what the vision in a glaucoma patient looks like. In a normal eye, on my left-hand side, you can see everything on your sides and in the center. In glaucoma, you develop tunnel vision and you can only see in the middle. So those are the challenges with glaucoma. So they tend to knock on objects accidentally, especially in the periphery. If you have anything to add, you can add. Okay. So the vitreous floaters he was talking about are here. You have the fibers degenerate and form floaters as you look around. So in your field of view, you see cobwebs and things moving around. is we have to learn how to live with them. Eventually, they settle down to the bottom of the eye and they're not too much of a nuisance. You can have laser therapy to disrupt very, very big ones, but they have to be in a safe place, not near the optic nerve and not near the macula, so that you can have that done. But otherwise, in general, they'll settle down with time. Now, age-related macular degeneration is what he also spoke about. He mentioned the macula being the central point with rods and cones that we use to focus, as I point here on my right-hand side. So this is a normal macula. When you come to the eye clinic and we are screening you for macular degeneration, we use a special machine called an OCT, and it gives us this kind of image of the macula. It should have a nice indentation, like a V shape where the fovea is, nice and clean. Now, in age-related macular degeneration, you see it's disorganized. There are lots of things that have been deposited there. And in this last slide, you can see even fluid has collected in that area. On my left-hand side, this is the vision of a patient with age-related macular degeneration. Here in a normal eye, you see everything, the two children with the two balls, it's clear. With central vision lost, you find a black spot in the center of your vision. And that's what happens in age-related macular degeneration. It is something where the solutions are not so many. If we have fluid that has collected, there are special injections that can be given to dry up the fluid so that you can see better. But if it's the dry type, there's not much apart from maybe using supplements and changing your lifestyle. If you're a smoker, you stop smoking, and making sure you have a nice, healthy diet. There is another condition which I've seen many elderly come in, and it's called, the skin sags around the eye. In the left-hand corner, this is the lower lid skin sagging with fat prolapsing, causing bugs. But when it affects the upper lid, like in this image in the right-hand side, sometimes it really sags so much until it covers the pupil. So some patients have come in saying, oh, Mzee can't see, we don't know why. He had his cataract surgery, he's fine, but he can't see, especially when both eyes are affected. And you find that simple reason was the skin has sagged and he can no longer open to see well. So this also can be corrected surgically, but it's one of the issues that may happen with your elderly loved ones. So he mentioned chronic systemic diseases, which are very important because as we age, if we have certain diseases like diabetes, hypertension, cardiovascular diseases, and even HIV, the longer you live with a chronic disease, the longer the more chances you have what we call end organ damage. So just like these diseases affect your liver, your function of your liver and your kidneys and the brain, the eye is not spared. You find that the vessels in the eye are blocked and the blood supply to the vital functions in the eye are impaired. So you end up with optic nerve disease, which we call optic atrophy, which is death of the optic nerve, or even the macula as well may lack blood supply and stop functioning as it used to. So anyone with chronic systemic diseases is at risk of developing visual loss as they age, because the longer the duration, the higher the chances of damage to the vessels, the vital small vessels that supply our vital organs. The key thing here is to make sure you manage the disease, keep things in control, and also monitor your medications, make sure that you are monitoring for side effects, if any. So, we mentioned a few diseases. Who are the elderly at risk? We know that our genes play a major role in how we age, just like our genes play a role in on our height and how we are born and many other things. Our lifestyle is also very important, and our underlying medical conditions, as I've mentioned already, are very important. So some of the risk factors are if you have a family history of an eye-related of diseases like glaucoma, you are at risk of losing sight as you age. Then if you have a disease like diabetes, which you've already mentioned, hypertension, heart disease, if you are obese, smoking, and if you're on chronic drug therapy, some drugs have side effects which affect the eye. If you've had previous injury. And then one important thing we discussed yesterday was nutrition. We mentioned the fact that as you age, you may live alone, and you may not be eating well. You may forget to eat, and if you are malnourished, you will lack the important vitamins that are required for your rods and cones to function normally. So you need to pay, as caregivers and even as individuals as we age, we need to pay attention to our nutrition. I know you are aware that you may be dealing with a patient who may have other diseases. For example, if you have a patient who has an elderly person who has diabetes, they have lots of restrictions in their diet. Then some may have lost their teeth, and they are also restricted in what they can eat. But it's still very important, even with those conditions, that you have a healthy diet. Because remember, your gut is not absorbing as much, and you need lots of vitamins, vitamin A, vitamin E, vitamin C, and the vitamin Bs to have a healthy macula and a healthy retina. Then, of course, we advise that you should have a regular exam at least once a year, even though you're fine, even though you go and have your eyes checked, because if things are detected early and treated early, you can prevent visual loss. So this is the Snellen's chart that he was talking about, and it is intentionally blurry here to show what it looks like when your vision is impaired. Ideally, it should be clear. So what are the signs of diminishing sight in your elderly as caregivers or as individuals? There are a few that I've listed here. Talk about them one-on-one. If you notice that your elderly is starting to squint or has difficulty in reading or is squeezing their eyes to see something, or even just the eye turning out in an abnormal direction, that is a sign that that eye is not seeing well and they need an eye exam. Then they may start to complain about night vision. I don't see well at night. I don't drive well at night. That means something could be going wrong in your macula. You need an eye exam. Any increased sensitivity to light should be assessed. Even any dull aches or pains in the eye, those should be assessed. Then, as we've seen in glaucoma, if your peripheral vision, the vision on the side reduces, if you have any flashes of light or floaters, it's important that it's important to have an eye exam. It's a sign that something may be going wrong with your eyes. Then the other is change in color perception. Someone doesn't see, says the colors look faint, or says something doesn't seem to notice the colors as well. That is a sign that vision may be dropping slowly. Double vision is also a very important sign. If someone says they are seeing double, it's a sign that there's something wrong, as he talked about the muscles that are integrated in the eye. Something may be going wrong and they need to have an eye exam. He also mentioned earlier the reduced depth perception, as the example he gave, where someone is pouring tea outside the cup. That is a sign that vision has reduced. Then another important one is inability to adjust to changes in lighting. When they move from a dark room to a bright room or a bright to a dark, they are startled. They have to wait a little bit for the rods to what we call adaptation. before they can see clearly. That's why you see some elderly are moving really slowly. When they move in, they have to stand a bit, pause a bit, then they continue moving. So these are some of the signs that show that vision has gone down. Then the difficulty in identifying faces, they don't recognize your face, they're bumping into objects, and then lastly, of course, when they have lost independence or they don't want to move anymore. The thing with the elderly is that many of them are scared of interventions. They are worried of potential complications or if things don't go well. So with sight, which is a very important sense in our body, they'll be the most hesitant to have it checked because they don't want to have a complication there. So they may not tell you, but when you see some of these signs, that is a sign that you need to have that discussion and say, why don't we go for an eye check and see what is wrong? The good news is there are some that can be treated and there are some where we can get additional support to make life easier. So we all agree it's a natural process, and we want to know what we can do to maybe prevent or slow down the process. There are a few things that can be done. One of them is to make sure you have your regular eye examination and prioritize all your eye appointments when they're recommended. If you've been diagnosed with glaucoma or any other disease, make sure you use your medication. Don't stop using your medication. We need to remember that the elderly may forget. So as caretakers, we need to make sure that you remind them about their eye examination appointment date. Have a calendar where you write a plan so that you know that in every May 15th, I need to take my patient for their eye exam because they will forget. The other thing is also to remind them about their eye treatment because it's important that they maintain their treatment. So find ways to make sure that they are able to use their drugs. Keep checking on them and ask, are you using your medicines? Are you using them as prescribed? Find ways where they can be stored in a convenient place, label them well, and if they need support in making sure that drops are put in, make sure there's someone at home to put in the drops as prescribed. That's the most you can do to preserve vision in their eyes. Then we've talked about nutrition. I'll repeat it again. Make sure that they're eating a healthy diet, whatever the circumstances, and maintaining a good, healthy weight. And for those who are overweight, you want to make sure that they reduce on what they're taking in, but it should be a nice, balanced diet. Quitting smoking and excessive alcohol is also very important in aging. Controlling your blood pressure and diabetes. Then practicing eye safety. When you go out to the garden, because you may have your hobbies that you want to do, make sure that your eyes are protected, because if you have diminished vision, you may not see a twig on the side, or you may not see something coming from here and there. So make sure your eyes are protected, either with protective eyewear, wear a hat to reduce on the UV rays that may come onto you. Try and make sure you protect your eyes as much as possible as you do your routine activities. And then as medications, especially those on chronic systemic diseases, you have to monitor what you're taking, watch out for side effects, ask questions about the potential side effects of any drug you're being given in relation to the eye. There are some eye drops which interact with some medications. For example, if you need a drug like timolol to reduce your eye pressure, then you have heart disease. Some patients have had some side effects and they may want to stop the eye drop because they feel it's giving them some side effects regarding their heart. So you need to monitor for all those side effects and then consult and see what can we change to, what can we do? Because some of the reasons why people do not adhere to drugs is because of side effects. So ask them questions, find out what is going on, because there are numerous options as to what may be giving you a side effect. Thank you for listening. This is all I have for you.
Wow, wow. Oh, thank you so much, Senior and Juliet. I think this was a timely, very timely session, especially for those who have attended earlier sessions. You could see the importance of the eye to all of us. Dr. Juliet, this was very, 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 very touching presentation. Thank you so much. Our senior, now we see exactly what it is to live with a senior person in the house, pouring tea on the side, coming from outside, and they don't want to hurry to sit down. Now we have the reasons, and we can see, and we are clearly appreciating how we should take care of them. I think we should give a big clap to the presenter this morning. You could put your reactions online too. At this moment, I think we have some comments and questions from the public, from everybody around. Let's share the questions and comments in the chat box. You can also raise your hand and we pick you to talk. Make sure you extract everything from Senior Otiti. He has such huge knowledge and experience. Don't let him go away without emptying his experience. Dr. Philip, as usual, could you help us handle the question, please?
Okay, thank you very much. Thank you very much, Dr. Kadama, and thank you, Doctors Otiti, Dr. John Otiti and Dr. Juliet Otiti. It was such a wonderful session. I like the practicality of it. Some of those things we see them, and I honestly never used to understand why tea was pouring on the side, but this is really very informative. So maybe I should start by allowing Grace, whose hand is up, to voice over her question, and then we'll read some of those that we have in the chat. Grace, please unmute and ask your question.
Thank you so much, and thank you to Dr. Juliet and Mr. Otiti for the deliberation. I have one question. If I have an elderly who has glaucoma and the doctors have only recommended surgery, and this elderly has totally rejected the surgery, what other way can I help or care for this elderly? Thank you.
Maybe handle that, and then we shall read the questions in the chat.
Let me leave.
Sorry?
Do you want to answer that?
You
question?
answer that.
Okay. So I believe we need to respect the rights of the patient. And if they are hesitant to have surgery, we need to support them with their decision. So the only alternative you have is to keep the eye pressure as low as possible as you try to counsel and ask if she can accept to have surgery done. And there are different medications, combination therapies that can be used. Unfortunately, in such cases, you may need more than one drug, maybe 3 or more, but you have to continue counseling about the need for surgery as you support her with at least what we call the maximum medical therapy. She may need more than 3 or 4 drops to keep pressure down. Yes, please add.
Glaucoma starts without our knowledge. So by the time it is diagnosed, a lot of damage has already been done. Now, what we notice among our people here, the African, we scar badly and pigment also quite a lot. So some of the surgeries in glaucoma may not work as well as in the whites. Now, to force a person to have surgery is a problem. If you don't supplement the medicine, the management with the surgery, the chances are it will go, the eyesight will go eventually, but it takes quite a bit of risk not to add in with surgery, because surgery opens the door directly from the anterior chamber to the blood system. You create an extra window outlet. One of them is trabeculectomy. You put a bit of iris above the sclera. I hope I'm right still. And then the water is absorbed from underneath the conjunctiva, but outside the eyeball as to where. Among the whites, that one works very well. But for us, we scar badly. And then pigments come around and it stops filtering. The intention which was there was to bring the water directly. The iris outside acts as a wick. I have had it done, it failed. So forcing a patient with glaucoma to have an operation, you run a risk of things going bad, and he blames you on the little that was remaining. But on the other hand, it may work. And what's wrong with the giving another option and supplementing mentary option when this old man or old lady will keep forgetting putting drops? And we sometimes tend to tell lies to the younger one. Have you put your medicine? Yes, I have. When he hasn't. And this pressure goes on all the time. It's not something that I'll put tomorrow and then it will work, and it will work for good. Every day has to have its share. Thank you.
Thank you so much. Petwa and Victoria, I'm going to get to you. Let me just get a few questions from the chat so that we have a mix of the voiceover and the questions in the chat. 3 questions from the chat is, can menopause affect the eyes? Does sickle cells affect eyesight? And thank you, Dr. Otiti, for your time to share this experience and knowledge. As said, we can't stop aging. There are conditions that which we have no control over. Which diseases in old age can be prevented or managed with early diagnosis? So please handle those 3 and then we'll continue. The first was about menopause and sickle cells, if they affect eyesight, and then which diseases in old age can be prevented or managed with early diagnosis.
Okay, I'll start with the first one. Menopause can affect the eye, and one of the commonest reasons, the commonest cause problems we get is dry eye. The hormones in the body balance the glands in the eyelids that produce tears to lubricate the cornea. So when those tears are reduced, you get a dry eye. Now, you may not know that you have a dry eye, you just experience grittiness, and it also gives some poor focusing. You don't see well. You put on your glasses, you still don't seem to see well. It is worsened when you are in the AC, if you're in an office which has AC, or if you're in the car, it is worsened. And then the eyes sometimes turn red, and you really feel uncomfortable, and there's a bit of pain. So that is the commonest symptom in relation to menopause. The other one would be, apart from what happens in both men and women, the rest, the other one would be the age-related macular degeneration is more common in women, and it has also been thought to be related to the hormone changes. So that could be something that would happen as well in relation to the changes in hormones and our eyes. And the second one is sickle cell disease. Yes, sickle cell disease is also another. All the vascular diseases can affect the eye. So the way the sickle cell disease causes blockage and diminished blood supply to different organs and causing symptoms, they also get blockages in the eye with bleeds and leakages in the retina. And when this happens in a vital place like the macula or at the optic nerve, then you have reduced vision. So sicklers should also have routine eye tests because they are at risk of developing ocular complications, which may reduce their eyesight. In both menopause and dry eye, and even in sicklers, hydration is very important. Make sure you hydrate as much as you can to keep the blood flowing and to keep your tear function flowing. The third question, the age diseases that can be prevented. I would say your lifestyle is the most important thing in prevention of age-related diseases. For example, if you eat healthy, you avoid smoking, you avoid taking alcohol, you keep your weight in control, then it will, in the long term, reduce the risks of complications due to diabetes, hypertension, and heart disease. And in that way, you'll be able to prevent some of these age-related diseases. The others, like presbyopia, cataracts, glaucoma, unfortunately, there is nothing you can do to prevent it. The only thing you can do is get it diagnosed early and start on treatment on time. I don't know if you have something to add.
Yeah, maybe just one or two points. What we do in life as we go towards aging can affect how soon the problems come. So preventive methods is not really to prevent what will happen, but let it not happen. Occupational hazard, like welding. You provide the welding glasses, the glass that cut off the particular infrared and the ultraviolet. And the welder will say, my eyes are all right, I shall use my own direct eyes. Now, slowly by slowly, the macula advances. Now, it may take him up to the age of 50, 60 when he retires, but he has already started. So if was scheduled to die at 100, by 60, he's already blind from what he was doing in the 30s. So protective appliances where they must be put should be used. And I wish this thing would be published all the time. Say people working in agriculture where things are sprayed, chemicals are sprayed to kill pathogens, they damage also the cornea if they land there. Now, it may be slight opacity at the beginning, but as you grow old, it increases, and you end up in old age, blind from what you were doing when you were still active.
Thank you very much for that. Petwa, I'd like to invite you to unmute and voice over your question.
Thank you. Thank you, our doctors, for the great presentation. I am a senior citizen. I have cataracts in both eyes. I have floaters in both eyes. Whenever I go to see my doctor, she tells me it's not yet time for my cataract to be removed. Well, I fear to disagree with my doctor, so I keep mum and come back home. But I'm anxious. Now my question is there a size, age, or what for a cataract to be removed? Thank you.
Just introduce this one. In the early days when we did not have many equipment now used, you have to wait for the cataract to be visible to you, the examiner, in total. Then when you are removing, you know the area covered. But nowadays, cataract surgery can be done much earlier. particularly in relation to your work. The cataract may be small, like I have, but in the center, preventing you from seeing small things. The visual field may still be all right, but the central vision is poor. You cannot read well, you cannot work properly. That may be force the eye doctor to persuade you to have it removed or recommend to you to have it removed while you're still working. But when you're retired, we are stubborn. And these days, Dr. Juliet will explain that it is possible to do them much earlier. But nowadays, you have to wait when the vision, the cataract itself is very uniform and seeing is a problem.
Yes, but what I also want to add is that the doctors usually have your best interests at heart. And there's always a reason why they would say, let us wait a bit. And you, as doctors, you want the best outcome for your patient. So there's probably a reason why she has advised you to wait. And I would, if you can navigate and you walk hand in hand with her opinion, that would be good. But you can also express your concerns if you're falling into things, you're not independent anymore, you have no one to help you at home. That decision can be considered and brought earlier. Otherwise, all in all, cataract surgery can be done early. There's no specific time, but we always want to do it when we know the visual outcome will be good, so that the doctor is happy, the patient is happy.
Right. There's a follow-on question. What is the cost of a cataract operation? What does recovery involve? And how long does the recovery take? Another question that another two questions is, you focused a lot on elderly. Can you elaborate more on dealing with loss of vision in the 40s? And then Annette also says she has experienced, she was examined, and found with an early cataract. Is it okay to have surgery done now? Please handle those, and then we'll take some more.
So the first one was, okay, about the cost for cataract surgery. Now, it depends on many things, and because some measurements have to be done, we have to know what lens you're going to use. There are varied lenses which have different costs. So that requires an examination for us to determine what lens is required for you, what type of lens you would want, for you to know the cost. But otherwise, the recovery is pretty fast. If everything goes well, the next day the patch is removed, you start on drops. I would recommend you get a 2-week leave so that you have time to put your drops and have your reviews done. But in general, cataract surgery is very, very, very safe thanks to technology. 99.9% you do well. It's only 0.001% that have issues and complications. And of those complications, they can also be handled. So it's one of the most beautiful surgeries that are in medicine, where you have good results and immediate results. The timing is really dependent on what we see in your eye, because as I've mentioned before, we want the best outcome for you. But they can be done early, even if it's diagnosed when you're young, or if in a baby. Cataract surgery can be done in a baby. So there's no age limit to when it can be done. The other question was loss of vision in your 40s. In your 40s, the biggest problem is presbyopia, which we talked about, where you feel you cannot see. The challenge with it is when it has just started, there are some patients who come in and they definitely have presbyopia, they need reading glasses. And sometimes you fail to adjust for some reason to your reading glasses at the beginning. before it has set in properly. And that's a challenge for many people in their 40s because they say, I got reading glasses, they still feel very uncomfortable. But if everything is done well, fitted well, you should be able to use your reading glasses and see better. That's the biggest challenge of vision loss in our 40s. And then also, of course, maybe the dry eye and things to do with hormones. As they change, you find things change. Cataracts can start early. I've had patients who have come in with cataracts at 45. So there's no age definition for cataracts because, for example, our hair goes gray. Some people gray early, others gray late. Same thing with cataracts. The lens will go gray early in some people. It's really genetic. In others, it comes in later. So once we hit 40, you know, things will start to happen. You may get a cataract early, you may get vitreous floaters, you may get all these other things at 40. So it's not really limited to the elderly. It's only that when you've lived with some chronic diseases for a longer time, the damage due to those diseases would be more evident, for example, in diabetes and hypertension. Yeah, you can add something.
The age of 40 is always mentioned, it's often mentioned. This is the time when the focusing for near goes down. It may not be complete loss of vision as such, but inability to see well near things. I mean, when you are doing small things like sewing and what, someone may call that as loss of vision. It's correctable by the appropriate glasses. 40 among Europeans, 45 there is when that failure to focus on small things begins. But somehow, maybe it is the sun or something like that. In our people, 38 is not abnormal to have reduced seeing well near objects. And cataract coming early, what we call senile cataract. That is old age cataract appearing in the late 30s in an African.
And then another important thing is when you hit 40, you still feel young, you look young, but it's important to start to check your blood pressures, check your sugars, because that's when things start to happen. Diagnosing them early and managing them early will prevent long-term problems later on in your 50s, 60s, and 70s.
Thank you very much. We still have a few more questions, so please do not tire. We have a, okay. Star says, thank you very much, doctors. I have been short-sighted for a long time and wear prescription glasses. After I turned 40, I realized I now have to take off my glasses to read. I have been exploring having laser surgery. I have heard that it works. What is your advice on laser surgery? Do you recommend it to people over 40 years old? And then Dr. Jen also is very grateful for the talk and is interested to hear on how often cancer can present in the eyes. And Gloria mentions that her mom had a cataract surgery on the eye, but she realizes that it is now shrinking. The eye is shrinking. And then are there any long-term effects on sight of using sigiri and firewood to cook? Okay, let's take those and then we'll collect another set.
Okay. I'll start with the one on laser. The laser therapy for short-sightedness. Now, what happens in laser is they change the thickness of your cornea because when you're short-sighted, your eye is very long, images are formed in front of the retina. So the cornea being the most important point for focusing rays, they alter the shape of the cornea so that it is a bit thin and it is able to reduce to focus rays better onto the retina. Now that only works for distance vision, seeing far. Your issue is you feel that you need to take off your glasses to read because you've developed presbyopia. laser therapy will not treat presbyopia. The surgical options for treating presbyopia are where you still do cataract surgery and put in a lens which corrects both distance and reading vision. The challenges with those lenses when you're young is that they have a few issues. For example, if you've used multifocal lenses, you notice that you need to look through different focal points to focus, to see the distance, to see the near. So this lens, which is multifocal, has those different focal points and with rings on the side. So you're able to read and see, but it causes a bit of glare, a bit of discomfort, and such patients are able to read at night, to drive at night. They have, the young people usually have issues with those type of lenses. So I would advise you wait it out. You could get a progressive lens if you don't want to take your glasses off. The laser therapy will assist with your seeing far, but it will not sort out your reading presbyopic problem because the problem is inside in your lens, not on the outside. It doesn't affect your cornea. Then the second question was about cancers of the eye. You can get cancers in the eye. Dr. Otiti talked about the UV rays that we are blessed with. So we have lots of long-term exposure to UV rays, especially if you are working outdoors, can affect your conjunctiva. And it has also been associated with development of some cancers in the eye. To some extent, those who have HIV are more prone to developing those changes which are cancerous on the conjunctiva in relation to the UV exposure. Then there are other cancers that happen, for example, at a young age. You can have intraocular tumors like retinoblastoma. Leukemias can also present for the first time in the eye. The melanomas, which affect the iris, which is the brown part of the eye, are not so common in the African race. They're more common in the white race, but they can also present as cancers. But yes, if you have a cancer and you're on chemotherapy, we advise that you also have routine eye exams because sometimes metastases are found first in the eye, but also the drugs that are used for chemotherapy can be toxic to your nerves and all that. So when we are able to detect that, we're able to speak with your physician and see what we can do in adjustment of your therapy. Then the other question was shrinking. Someone had surgery and the eye looks like it's shrinking. I haven't seen the patient, but these are my thoughts. I would think that before cataract surgery, there are different kind of local anesthesia that is given to the eye. So there's one where it's given at the back of the eye, which is called retrobulbar anesthesia, where an injection is given right at the back to numb the eye so that you don't feel pain during the surgery. Then there's another technique where we give it just around the eye, where we don't really go to the back. So the retrobulbar anesthesia at the back paralyzes all the nerves, including the nerve that lifts the upper lid. So many patients after that anesthesia, they get a slight droop of the upper lid and it appears that the eye looks smaller. So it's possible that that is what you are interpreting as a shrinking of the eye, but with time, it may improve and start to open wider. Otherwise, if the eye can see and it looks smaller, it's probably that. If the eye is shrinking and vision is dropping, then I would think that there is a bigger problem and you need to go back and see the doctor and see what you can do about it, because there are many things that could be happening if an eye shrinks after surgery and vision is dropping. Then the last one was about Sengeri, smoke and the eye. Maybe you can answer that one.
It's just an irritant, but I don't think it affects the vision very much, but can promote frequent infection. It's too much watering, and when the eye waters, you tend to rub the tears off, and the hands may not always be clean. So the dangers of introducing bacteria into your eye when you're using Sengeris and charcoal and so on. It's more of provoking the eye to get infected rather than affecting the vision per se.
Yes, and also if you've had an eye surgery, because the eye has been open to the exterior, we always advise you avoid going to the Sengeri to poop during the immediate post-operative days because of what he has just explained, because the smoke, there's dirt, then you touch your eye and then you introduce infection. So we advise that you don't do that until you've healed.
Can I just mention? Sorry.
You can mention.
The drooping of the eyelid after surgery in cataract is quite common. But one of the reasons is you are trying to cut down the light. So if there are competing chemicals in the brain, one tells the eye to open, the other one tells the eye to go down. I think the inhibitors are more, they work to reduce the light entering the eye. Mark, you had cataract surgery and you are old. The pupillary size itself is small, and the eye does not have any control on incoming light. So in an attempt to squeeze your pupil, which is reluctant to squeeze it to narrow, because it's degenerated, the eye tends to be forced to come down. It's not quite a paralysis as such. I think it's a competition between the inhibitors and exciters.
Right. We have a question which is important in this era, digital era, asking you to talk about eye complications caused by using computers or screens for a long time in this digital era. Then I see Agnes JM hand up, so I'm going to skip her question. We will give her a chance to voice over. And there is a question about, have you seen any effects from chemicals that ladies use as makeup? Are there any effects of those on the eyes? And would you say there's a relationship between loss of eyesight and mental health? Thanking you for the details on eye surgery. Then there's a question. Someone says, I'm 40 and living with low vision. My near vision is worsening, even with the reading aid. What should I do? My daughter and I have a brown patch, like a birthmark in one eye. Will that be a problem later in life? Then this is about the recording. Yes, we shall share the recording. Please handle those and we'll listen to the people whose hands are up.
So the first question, I'll take the first one. The first question is about the digital era and computers and your eye. The eye, I would say, is like any other organ. You need to, if you run a lot, you get strain, you get muscle strain. If you use a certain part of your body a lot, it will get strained. So if you use the computers 24 hours, you're always on WhatsApp, you're always on your phone, you're always reading, of course you get tired and you get a bit of strain. Then of course, some people are sensitive to the glare from the computer, and so they get sensitive and they need anti-glare lenses to be able to use the computer comfortably. And then, especially with children who are always looking very close to the object and they're addicted to scrolling, and instead of reading a book or going to play out in the fields as we used to do when we were young, you have more of them coming with all sorts of refractive errors early or accommodation issues because they're using the screen at a close range for a very long time. But otherwise, the computers per se do not damage your eye or cause a disease. It's just that you're using them excessively, the glare is a bit uncomfortable, and focusing on something near at a young age for long hours eventually affect your accommodation and other muscle functions. I don't know if you have something to add.
Yeah, computers within the near vision area. The eye actually at rest is not parallel, they are divergent. The way the creator created the eyes within the orbit, they are divergent. That is when all the muscles are relaxed, the ones that move muscles. Now to read near things, the inner muscles have to pull the eyes to being parallel. Now keeping those muscles working overdrive will give you this, what you call strain, headaches and whatnot. And it's recommended that when you are at a computer, you don't go on for hours, you gaze far away. But that still is not enough for the eye to rest. You be absent-minded, that's when the eye rests, the muscles. When I was still teaching, I could tell the student who's not paying attention, they look like they have squint. That one is far away from you.
Okay, and then the other one was makeup and the effects on the eye. I mean, the makeup, you have the eye pencil, the eyeliner, eye pencils, and then the lashes. And now there are people who want to put permanent lashes and stick them on. So the problem is these have chemicals. So if those enter your eye, they will affect you, get a red eye, conjunctivitis, burning sensations, and all that. So you have to really be careful that they don't enter your eye because they are not chemical free. Then we've had a few people come in with all sorts of reactions, especially in the conjunctiva, because of the particles of the makeup resting in the eye. Especially if you don't wash it off at the end of the day, you sleep with it. When you're sleeping, you don't know what you do when you rub, and you don't know what you do in your sleep. So those particles tend to enter, then you have almost like a foreign body reaction. You see signs of a foreign body reaction, and you see particles of the black eyeliner within the eye. So if you want to wear makeup, make sure you clean it off at the end. Take care that it doesn't enter your eye. Be very, very careful. The third question was mental health and reduced eye vision. There are two ways. It's important that definitely if your vision is deteriorating, it will affect your mental health because you are anxious. You want to know whether there's a solution, and if you have one that is irreversible, these patients need a lot of mental health support. They can't be left alone, and it needs to be a multidisciplinary approach where you work with a mental health team to support them to accept whatever condition they have, especially if it's irreversible. When someone is diagnosed with a visual deteriorating condition, we need to give them support, reassure them that they'll be fine, especially if it's something that can be cured. Check on them so that they may have some positivity in their lives and see how to support them in one way or the other. But yes, also in the other side of it, we found people who have Alzheimer's and other degeneration diseases are more prone to having diseases like glaucoma. And these are patients who can't speak. Their memory is gone, they can't talk, they will not tell you that I feel something is wrong. So such patients also need to have routine eye checkups because they are prone to having certain degenerative diseases which affect both the brain and the eye, and treatment can be given to reduce further deterioration of vision. Okay. Then there's a lady who has a brown patch. Her mother, she's a mom, and her daughter, they have a brown patch in the eye. It's probably a pigmented nevus, which you were born with, like a birthmark. Usually they don't have problems. They don't cause problems, but they need to be watched in case they grow or change. Then we need to excise it and make sure that there's nothing dangerous going on there. But a few people are born with those spots and they remain the same throughout their lifetime. They are benign, they are not dangerous.
There's usually, at least in the tropics, a tendency for our conjunctiva, the white part of the eye, to be pigmented, especially on the nasal side. It starts as a yellow thing that is common in most people, just a patch of fat protruding like a pimple on the inner side of the black or the cornea. The moment it starts going black is when you need to be worried. While it is yellow or white or red may not be as serious, but when it starts going pigmented, there's a cancer common in eyes from the conjunctiva, squamous cell carcinoma. It will go pigmented. So the pigmented ones should be examined by the eye care people. Maybe even do an excision, removing that spot. Since the healing of the conjunctiva is very fast, sometimes within 24 hours, the thing is closed and leave you worry-free.
Mm.
Okay, thank you very much. I'll ask maybe Agnes to go first, and then we'll hear from Grace. And those will be our last two questions. Please unmute and voice over.
Hello. Thank you, doctors, for the presentation. I have put my question in the chat, but it seems it didn't come. I've got my elderly friend and husband who got cataract operations at 86. That was late last year, and the doctor abroad. And the doctor told us that for the glaucoma, there's nothing she could do. We have to manage the diet, and she could not comment about the drops which she had been put on before we left home. So we came home and continued. We are continuing with the drops. And she said if we don't manage the diet very well, and the diabetes, he can even go blind. An advice on that? He's now 87. Thank you.
Okay, let's hear from you, Grace, and then the doctors will take the two questions together.
Thank you again, Doctor, for enlightening discussion. I am back with a question on the dryness of the eye. I am above 50 and I was diagnosed with this dryness of the eye. And in conjunction with the person who asked the Victor era, since I am wearing glasses, I've been given glasses. He said I'm on computer full time because of my job month. The only diagnosis I've been given is the artificial tears. I would like to hear from the doctors. Is there any other better management I can do to help my dryness of the eye? Thank you.
Okay, yes, okay, let me start with the first question. It's about a patient who had cataract surgery, that's diabetes and glaucoma, and you were advised to, there was emphasis on diet, because if you don't work on your diet, the patient may go blind. So what I understand from that situation is that probably the diabetes is not well controlled, and probably you've not appreciated what diet, how to control your diabetes. One of the things with diabetes is that you have to learn to manage it yourself at home. You must have a glucometer to measure your sugar levels. You need to know what you're eating before, what your sugar is before, and know what it impacts on your sugar level after the meal you've taken, because there's no other way but to strict control of diet to control sugar. And the doctor's advice is right. You really must control your sugar levels if you're to prevent blindness due to diabetes, because the high sugar levels will continue to cause problems at the back of your eye, cause abnormal vessels to grow, leakages to happen, bleedings to happen, which cannot be reversed. So the most important thing is to focus on diet. Get a glucometer, see what you eat, and try and control what goes in and what goes out. The glaucoma, if it's there, needs to continue treatment. As we mentioned earlier, even if you've had surgery, even glaucoma surgery, many people need to continue with drops. So I advise you to continue with your eye drops and have an eye check locally here. Get it measured so that you know where you stand and take it from there. The other question was regarding dry eye and artificial tears. And dry eye is one of those diseases which are quite, quite annoying, because you have to keep using drops to alleviate your symptoms. One of the things I would advise is hydrate as much as possible, take lots of fluids, and avoid AC if you can. If you have AC in the office, try and have it removed. The natural air is better. Good quality artificial tear supplements that you can use. The current one is not working well for you.
Right, thank you. I'd like to hand back to moderator.
Thank you so much, Dr. Philippa, for the Q&A session. Thank you so much, Dr. Otiti Senior and Junior. We've been taken through aging from 40 or below 40 years to the time when we rest, really. And we have seen our caregivers, and that means all of us, because at 40, you are really caring for someone else, but remember, you also need attention. This session has been very, very, very essential to all of us, and you've taken it very down to earth. You've given it out very, very well and down to earth. We've been able to understand the whys, and therefore we will be able to do what is necessary to keep these issues, diseases at bay. Caregivers in particular, I think we are richer now in knowledge of how to handle the seniors. You realize there could be a situation where they can't see on the side. Give them a driver, give them safe means of transport. If you've been using a bicycle, remember you won't be able to see this way and that way at a certain age. Instead of barking at him that you bumped into this one, you did this, blaming should be minimal, but help and attention to details, like we were told, if you see someone squeezing their eyes to see something, you remember there's something not right, take them for the medical checkups. I think we are richer in looking after ourselves and looking after the seniors, for the caregivers we have on board now. Thank you so much. I think Dr. Philippa forgot to tell you that we do have a YouTube channel, and we've had a recording of this session, so it will be available sometime for those who would like to share with friends and other seniors who have not been around this morning. Again, I would like to ask everybody to give a thunderous clap for the Otitis. Our senior, we are so happy to have you on board, and we hope you join us again in other sessions. We do have a session at end of the month every Saturday from 10 a.m. Thank you so much. We've been honored. We are rich and we are very happy. Thank you, thank you, thank you.
Dr. Otiti has some closing remarks. Maybe you can allow him to say something before we end.
Yes.
Yeah, please. I just wanted to add something on the caretakers. Like diabetes, glaucoma is you yourself manage the treatment. You are old and you're on your own. So if every patient could be taught how to apply eye drops by themselves, there will be a bit of wastage, but they need to learn to put it, because the young generation will not always be there to help you. The other one is on getting some idea on things going on in the eye. In the eye test, we have what we call the red reflex. If you put someone in a dark room and make it, say, a black piece of paper and make a small hole with a pin, and you look at them, you shine light at the eye of the patient or the person you're examining, the red light will come from their eyes into your eyes. And any opacities, early or late in that media, you will notice. So this is one of the ways of identifying early disturbances of vision in the public. So the red reflex for examination and teaching old people, and everybody anyway, how to apply eye drops in the eye. Thank you.
Thank you so much, Dr. Otiti. I would like to close this session and invite you back at the end of November for the last session this year. Otherwise, have a good weekend, and thank you for joining us. Thank you for sparing Saturday morning. I know some clinics are heavy, but thank you. Thank you is the word. Thank you.